perform a return demonstration about hair and scalp shampooing and bathing and skincare.
My name is Diane Rixie M. Castellano.
My name is Romelin Heidi Hamis Ibarli.
My name is Rilini Enriquez.
My name is Karen S. Herodias.
I am Girly Ann Cantillas.
I'm Steffi Lotes Raiza Isarza.
I am Abigail Filizoria.
I'm Apple M. Kasha.
I'm Daya Ruby Queen. I am Zeda Natalibi Impinado.
First, review chart for any limitations in physical activity and bring necessary equipment to the bedside table. And then, perform hand hygiene and put on gloves. So after putting the gloves, identify the patient, discuss procedure with patient to assist in the bathing process, close curtains around bed, and remove sequential comprehension devices and anti-embolism stockings. So after that, remove gloves and perform hand hygiene. And after removing the gloves and perform hand hygiene, adjust the bed to a comfortable working height, usually elbow height of the caregiver. And then put on gloves and assist patient to the side of bed where you will work. Have a patient lie on his or her back. Loosen top covers and remove all except the top sheet. Place the bath blanket over the patient and then remove the top sheet while the patient holds a bath blanket in place. Next, having a basin with a sufficient amount of comfortably warm water to begin the bath. Fold the washcloth like a mitt on your hand so that there are no loose ends. Lay a towel across the patient's chest and on top of the bath blanket. With no cleanser on the washcloth, wipe one eye from the inner part of the eye near the nose to the outer part. Bath the patient's face, neck, and ears. Apply appropriate emollient. Expose the patient's forearm and place the towel lengthwise under it. Using firm strokes, wash hand, arm, and axilla, lifting the arm as necessary to access the axillary region. Rinse if necessary and dry. Place a folded towel on the bed next to the patient's hand and put a basin on it. Soak the patient's hand in the basin, wash, rinse if necessary, and dry your hands. Repeat actions 15 and 16 for the arm nearer you. After that, spread a towel across the patient's chest, lower bath blanket to the patient's umbilical area. Wash, rinse if necessary, and dry chest. Keep the chest covered with a towel between the wash and rinse. Pay special attention to the folds of skin under the breast. Then, lower bath blanket to the perineal area. Place a towel over the patient's chest. Wash, rinse if necessary, and dry abdomen. Carefully inspect and clean the umbilical area and any abdominal folds or creases. The next thing to do is to return the bath blanket to its original position and expose the far leg. Place the towel under the far leg using firm strokes, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Apply appropriate emollient. And wash, rinse if necessary, and dry the foot. Pay particular attention to the areas between your toes. Repeat actions 24 and 25 for the other leg and foot. Make sure the patient is covered with a bath blanket. Change water and washcloth at this point or earlier if necessary. Another step is to assist patients to prone or side-lying positions. Position bath blanket and towel to expose only the back and buttocks. If not contraindicated, give the patient a back rub. Apply appropriate emollient and or skin barrier product. Refill basin with clean water, discard washcloth and towel, remove gloves and put on clean gloves. After putting on a clean gloves, help the patient put on a clean gown and assist with the use of other personal toiletries, and then protect the pillow with a towel and groom the patient's hair. When finished, make sure the patient is comfortable with the side rails up and the bed in the lowest position. After changing bed linens and dispose of soiled linens, remove gloves to prevent cross-contamination and perform hand hygiene to uphold infection control standards.
I am Retdem Enriquez.
Identify patient using two identifiers including name, birthday, or name and medical record number.
My name is Retdem. Your age, 8. Your age,
The second one is to determine whether a physician's order is needed before a shampoo can be given. Next, assess activity tolerance of the client. Check for the existence of any scalp problem. And also the equipment is already assembled. And the fifth one is to explain to the client what you are going to do and why it is necessary. And then, provide for client privacy and assist patient to the side of the bed from which he will work. The next one is to arrange the equipments. Put the plastic sheet on the bed under the head and cover it with a draw sheet or bath towel. And then, place Scalp pad over the bath towel and let its end extend to the receptacle or pail. Then, place newspaper on the floor under the pail. The next thing to do is to put a folded washcloth or towel where the client's neck rests on the Scalp pad. Tuck another bath towel over the chest and around the client's shoulder. The next thing to do is to fold the top bedding down to the waist and cover the upper part of the client with a bath blanket. And then place a washcloth over the client's eyes and place cotton balls in the client's ears. So after putting the washcloth and cotton balls, gently comb hair well, observing scalp and hair for color, texture, distribution, scaling, infestation, or infection. After that, wet the hair thoroughly with warm water, directing water away from eyes and ears.
Sandabit sa ears.
Consulate ko na dyan. Yung mo.
Mana,
Stop a video.
So after wetting the hair, place a small amount of shampoo into the hands, working it into a lather and massage it into the scalp and hair. So after applying the conditioner, rinse the hair thoroughly. Squeeze as much water as possible out of the hair with hands. Then, pat dry hair with a bath towel and wrap turban style. Remove Scalp pad, rubber sheet, and position client comfortably in bed. So after the procedure, ensure client comfort, remove bath blanket, ensure that client's clothing is dry, position to a comfortable position, and keep patient warm with top sheet and blanket in place. Then, dispose or clean equipment and return to the supply room. After doing the procedure, perform hand washing.